Good afternoon, ladies and gentlemen. This is Robert Chappell, Executive Editor here at Madison365 with your daily update for Friday, December 4th. Today, um, the coronavirus numbers look pretty similar to yesterday's, actually, which I guess is, not a bad thing. It's not a good thing either. We do have a couple of milestones. Well, one big milestone today, and that we passed 400,000 cases total. We knew that was going to happen today. We were only 300 short as of yesterday. So today, our total for the entire span of the pandemic is 404,555. That accounts for 4,847 new cases just today, which is more or less in line with the last few days. We're still seeing testing. The testing has gone up today, but it's still the percentage of positives is still significantly high as well. We have about 3,000 more tests today and 2,000 more cases, right? If you have 3,000 more tests, you would like to see like maybe 100 more cases, right? But to have 2/3 of your increase all be positive is just bonkers. So what that means is for the day today, the positive test rate is 32%, which yesterday was 38%. Okay, so slightly better. Still ridiculously high. The problem, though, one of the problems, is that the 7-day positive test rate, I gotta find my spreadsheet here, is now 32.7, which is 31.7 yesterday. It's a 7-day rolling average. Rolling does not mean spiking. It should not be jumping by a full percentage point. It shouldn't be going up or down by a full percentage point on any given day. Right? The idea is that you're trying to smooth out by looking at a 7-day average. You're trying to kind of smooth out the ups and downs. So for that 7-day average to jump 31.7 to 32.7 is a big jump, and that's the third. No, I'm sorry. That's like the fifth or sixth. Yeah, the fifth significant increase in a row. It hasn't been exactly 1 percentage point each day, but it's one day it was more than one. But that's surging in the wrong direction. You might remember that peaked several weeks ago at 36.5. That was back on the 15th of November, so almost 3 weeks now. And then it was going down every day for 2 weeks, and then now it's starting to surge back up, which is, we are now at the time when we will start to see Thanksgiving in the numbers, and I wonder if that's what we're seeing now. Not only are we seeing things went down like kind of during the Thanksgiving holiday period because there wasn't as much testing, but I think as testing is coming back up, you start to see the numbers go back up. But testing should only affect the actual number of cases. It shouldn't really affect the percentage. In fact, if you test more, that percentage should go down. If you're testing more people that are more likely to be negative, the positive rate should go down. But it's not. It's going up. So I think we're starting to see that Thanksgiving surge, and we will see that continue probably through the weekend. Now that 32.7 is 32.7% of people who were tested over the last 7 days have tested positive, which is really high. The other number that's important, that's really high, excuse me, is the number of tests. Because many people, healthcare workers, university employees, first responders, etc., are taking multiple tests every week. And hopefully, ideally, they take a test 3 times a week to test negative all 3 times, and those all get counted and into the data because we want to know that. So, given all that, 14.2% of all tests were positive in the past 7 days, and that's up 0.5% from 13.7. That needs to be 3 or less. When that got up to 3 in New York, they shut all the schools down. Like, that's where we're at. Like, we should be, like, if you go by any other state's metrics, any other state, it would be dramatically closing schools, closing businesses. We'd have a curfew because we're almost 5 times higher than that, and we're still not doing anything really. So anyway, those are the numbers. I'm not here to advocate. I'm just here to let you know the numbers. Peggy, that's a good comment. I will respond to that in a minute. Now today we also we've had a high number of deaths for each of the past 4 days. I would anticipate another day of deaths in this range, and then we'll probably go back down for Sunday and Monday, as we have typically done for the past month and a half or so. But today we're reporting 64 deaths. Yesterday, you remember, we reported 62. The day before that, we reported 82, and then on Tuesday, we hit that 107. That's after 104 the previous Tuesday. Like, Tuesday is the day when, like, we did a lot of catch up over the weekend. So what that does, though, is puts our daily average of deaths to 52.3. Now that peaked at one point right before Thanksgiving, like Tuesday or Wednesday of last week. That peaked at 55, and then over the course of the holiday weekend, they just weren't being reported, which is to be expected because, like, it takes a while and it takes a bunch of paperwork steps to get that fatality confirmed as a COVID fatality. And when county offices and state offices are closed for the holiday, like, there's about 4 days there when we reported hardly any deaths at all. So the average, the 7-day average, went down precipitously all the way down to like 43. And now it's back up to 53. For context, even 43 is very high. Even 43 a day, if you put it out, if you take that daily average over a whole year, which is not appropriate to do, but if you did, it would be by far the number one killer of people in Wisconsin. Right now, heart disease is the top killer of people in Wisconsin, and that kills 31 people a day. Now, it does that year round. This has only been at this level for about a month, right? So not exactly apples to apples. But if we let this virus run rampant and don't get vaccinated and just like let it run for the next year, it would be far and away the number one cause of death in Wisconsin. Far and away the number one cause of death in Wisconsin if we just let it roll, which thankfully we are not doing. Okay, so we now have a total death toll of 3,625. So we went past 400,000 new cases. We went past 3,600 deaths. Our active cases, here's one bit of good news. There's 2 big bits of good news here I'm going to tell you. Number one, our active cases are going down. That's at 63,000 right now. That's 15.6% of total cases are currently active. Now that's partly because lower testing means we're finding lower numbers of cases, and the way they measure that active number is like basically 30 days. So 30 days ago, you have 6,000 cases that fall off and are no longer considered active, and we're only adding 4,800 today. So that number goes down. But it also continues to go down as a percentage of the total number of cases, which I'd like to see. That's the one piece of good news. The other piece of good news is hospitalizations continue to go down. The current number of people hospitalized is 1,660, which is 94 lower than yesterday. That is tremendously good news, I think. That's still, it doesn't mean everything's fine. It doesn't mean there aren't currently specific cities or communities where hospitalizations are high, like in Dane County. It went up again today. The three hospitals in Madison, which are the only hospitals in Dane County, have 9 more people than they had yesterday. So that's, they're stretched very thin. But other hospitals maybe are in better shape. There's also a question of staff capacity. Even if there are rooms that are available for COVID patients, that doesn't necessarily mean there's the staff available to take care of them. So that's not to say that everybody's fine. Hospitals are okay now. Like just yesterday, 34% of all statewide hospitals were reporting critical staff shortages. That's really bad and really frightening. And that critical staff shortage could become catastrophic if that hospitalization number goes back up. Even if it goes up in specific places. But that statewide number coming down gives it just a tiny bit of breathing room for those hospitals, for the hospital staffs. Again, specific hospitals could still be having really critical problems. Okay, so that's the other piece of good news. I'm going to talk about more bad news. Talk about the deaths and where they occurred real quick. I'm going to talk about cases and where they occurred. The deaths were pretty spread out today. 30 different counties reported at least one fatality today. Racine County led the way with 9, followed by Waukesha County with 8, Rock County with 7. I think that's the most we've seen on Rock County in a day. Milwaukee County then 3, Kenosha and Dodge also 3. Winnebago, Ozaki, Oneida, Lincoln, Clark, Burnett, and Brown County each report 2. Wood, Wapaka, there's a long list, guys. Walworth, St. Croix, Sheboygan, Sawyer, Polk, Outagamie, Monroe, Marinette, La Crosse, Forest, Fond du Lac, Crawford, Calumet, Barron, Ashland all report 1 today. And then one county, let me see what it is. Marathon County actually took 1 death back out of the data. So our total went up by 63, even though we're reporting 64 deaths because we had 1 that was corrected. In terms of new cases today, again, 4,847 cases today. Again, it's the rural counties that are being hit hardest. Menominee County, 213 new cases per 100,000 residents. Now, that's per capita. Menominee County doesn't have a very large population. So 10 new cases in Menominee County is basically the same as like 200 cases in Fond du Lac County. Right? Does that make sense? That'd be like, I don't even know. That'd be like a couple thousand cases in Milwaukee County. Right? Fond du Lac County, speaking of that, is second with just under 200 cases per 100,000. And then you have Wood, Ashland, Dodge, Taylor, Crawford, and Clark all over 150 new cases per 100,000. And then it drops off. It takes a long time to get to Milwaukee County. Milwaukee County right now has 85 cases per 100,000 today. They have the most new cases today, 805, but that's only 85 cases per 100,000 residents. So again, 10 cases in Menominee County is like 2,000 cases in Milwaukee County. It's just, there's such a mix of rural and urban counties in our state, and that's just how those statistics shake out. So I wanted to address this question but comment from Peggy Weaver. This morning, Public Radio said the number of positive cases are going down, which of course is true. But it's frustrating that it was not put in context. We don't need people feeling overly confident about rates going down when they're not. You're absolutely right. I'd be interested to hear what they had to say about that, because you're right, it is true. We have our average number of new cases is now 3,948. That's over the past 7 days. That's considerably lower than it was. That was well over 6,000 not very long ago. So you just look at that number and you think, oh, we've turned a corner. Things are good. But they're not, because the reason that is going down is because testing has been lower. Today, testing is back up a little bit more, a little bit better. But people went to Thanksgiving. A whole bunch of people went to get tested before Thanksgiving to see if they could go to Thanksgiving, which is questionable. But now people have been told, and I think they are waiting to get tested after Thanksgiving. Either they're taking a week to start to feel sick, or they're just doing the just to see kind of tests when they're pre-symptomatic, and they're not doing that until like today or yesterday, and we don't have the data into this data yet. So I would anticipate we'll be starting to see that like 16, 17, 18,000 tests a day, maybe today or maybe like tomorrow, and then it'll dip back down again Sunday, Monday, and then it'll go back up Tuesday probably. But you're absolutely right, Peggy, that the raw number of new cases every day is not particularly relevant. It's relevant. I mean, we want to know, but But the problem is, when you're not testing enough, there are lots more than 63,000 active cases in Wisconsin right now. There are only 63,000 that we know about. But we're going to find 5,000 more tomorrow, and maybe 6,000 the day after that, which are active now, which we won't know about until tomorrow or the next day, right? So we'd like to do more testing. We'd like to find those cases so we can isolate those folks and stop the spread. That's the whole idea. But again, you're entirely right that we have to be very careful about how we present this data. Now, that's also, we don't want to go the other way and say, oh lordy, the percentages are going up, therefore everything's burning to the ground. We don't want to scare anybody or cause panic. We want to be truthful. We also want to be truthful about the people, who it is that is dying, who it is that's being who it is that's being hospitalized. Now, I want to mention the deaths today. We know of at least one teenager who has died who is not yet in the state data. It takes, a week or two to make it through the proper reporting channels to get in the state data. Today, the 63 people who have died, one is in their 30s, 2 are in their 40s, 7 are in their 50s, 7 are in their 60s, 15 are in their 70s, 15 are in their 80s, and 16 are in their 90s. Now that is obviously most of the 63. 46 out of the 63 are aged 70 or older. That's the most vulnerable population. So a lot of people think, first of all, that that's okay, because these are old people anyway. I don't think that way. But secondly, that there's this idea that if we could just protect the old people, just lock down the nursing homes or whatever. But first of all, a lot of people in their 60s don't live in nursing homes. A lot of people in their 70s and 80s don't live in nursing homes. But also, younger people, this today specifically, the age range is much more spread out. We've had 14 people in their 20s die. Now that's a small percentage out of 3,560, out of 3,625, 14 were in their 20s. Okay, that's a small number. Like you don't want to exaggerate that. You don't want to overstate that. But people in their 20s are not immune, obviously, to dying. But we also want to be honest and say if you're in your 20s and you catch it, you're very, 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 very unlikely to die from it. If you catch it in your 70s, you're much more likely to die from it. Something like 12% of people in the 70s who catch it die from it, whereas less than 1/10 of 1% of people who catch it in the 20s die from it. Right? So again, context is very important. All those data points are important, and it's really easy to grab one number and make a case with that number for whatever political agenda you want to, we want to open up more, we want to shut down more, we want to open schools, we want to shut schools. You can grab any one number and make any case for it. But data has nuance, especially this much data. So I try very hard every day to give you that nuance and to kind of explain that. And it gets a bit wonky and statistical. But I think it's important to try to understand that. So that's why I started doing these live, updates, is just to try to put some context around those numbers, because it's hard to write, it's hard to read. It's easier to talk through. So, okay, so that's what I have for you today. A couple other news items that I'll mention just real quick. There's a nonprofit organization called MADAM that is celebrating its 5-year anniversary. It's it teaches young people, middle school kids, girls and people of color especially, how to code. That helps get them excited and ready for that career, because those careers are very white and very male. So there's a really nice story on the website right now by Naomi Wolf about that. So take a look at that. We have a minute. I think it's slid off the front page by now, but if you go to the Madison section of the website, you can see it there. And the other thing I'll note is that you might remember in Madison here, Anissa Scott was an 11-year-old girl who was killed in a shooting. She wasn't the target, I don't think, but she was shot in the head and died. And her great-grandmother also lost a nephew and a brother and a husband, all this in the last few months. And so Michael Johnson, the Boys and Girls Club CEO here, and some other folks are kind of getting together. Dan Hawk, who's a contractor, are getting together and just basically giving her a home makeover, like top to bottom home makeover. The Concourse Hotel has chipped in to just put the family up for the 2 weeks while they get their house done. And it's a really nice story. That's on the front page of the website as well. And you can help. They need donations of furniture as well as money just to pay the contractors and stuff. So I would take a look at that and help out if you can. That is all I have for you today. Don't forget that we are a nonprofit newsroom. As I talked about, we want to give you all this information and help you understand it. That's the two really important things. We're going to give you the facts and help you understand them. And that takes a lot of work, and it's not free. And we pay people to do it, right? Our journalists are professionals. We pay them. They're young, but they're professionals, and we pay them. And we have to keep the lights on, and we have to keep the website up, and we have to, all that stuff that you need to run a news organization. Our overhead is very low. We don't have a newsroom. We don't have an office or anything like that. We used to, but COVID kind of, don't need one anymore. Everything's on Zoom anymore, right? So, the studio is just a corner of my attic. So if you make a donation, that money all gets invested in the community and in getting our professional journalists into the community to tell the stories of this community. And any donation you make right now is doubled by Newsmatch. It's a program from the Institute for Nonprofit News. You give us $10, we get 20. It's that simple. It is really that simple. So go to Madison365.org/donate. We never want to charge for the news. We always want everybody to be able to get at it for free. But if you have the privilege of $10 extra, toss it our way, and Newsmatch will give us another 10. And that kind of really amplifies your impact on our day-to-day operation. So thank you for your attention. I appreciate it, and we will. I'll be back tomorrow with another update. It's a weekend, but enjoy your weekend, and I'll be back tomorrow afternoon.
This is 365 Media.